In this presentation, I will discuss the safe use of NSAIDs or non-steroidal anti-inflammatory drugs, as well as commonly observed side effects that we do see in the pharmacy. First, we need to know what are NSAIDs, non-steroidal anti-inflammatory drugs. They are commonly used to treat pain, fever, and inflammation. Over-the-counter and prescription-only formulations are available. And examples include drugs like ibuprofen, indomethacin, naproxen, and aspirin. And aspirin is somewhat unique in how it works, but not in what it is. It is an anti-inflammatory drug, and a non-steroidal one specifically, but it does have irreversible binding capable or property, and that's why it's used for some other conditions, not specifically including pain and fever and inflammation. Now, very commonly found also in combinations with other drugs in analgesic, antipyretic, and cold preparations. An example would include something in the cold preparation front that we see in South Africa would be IB Max or Advil CS, which are basically the same thing, ibuprofen with a decongestant. In the analgesic and antipyretic form, they are found in combinations often with codeine and paracetamol, which is all for pain and fever. Specifically, paracetamol is a very good antipyretic. Paracetamol is not considered a non-steroidal anti-inflammatory drug and doesn't have similar side effects. It is something quite unique, and I don't think there's another drug like paracetamol specifically on the market. Now, how do NSAIDs work? Now, NSAIDs work by inhibiting the production of prostaglandins. Now, just to go a little bit into the physiology of this, prostaglandins are inflammatory agents that cause these inflammatory responses in our body. Among other effects, it's quite a variety of effects and a wide range of effects. These things include fever, pain, the redness that you see with inflammation, all related to the prostaglandins and other biological compounds released from a compound known as arachidonic acid. Now, this conversion from arachidonic acid to prostaglandins are a result of the cyclooxygenase enzymes, COX-1 and COX-2. Now, drugs bind to these drugs bind to COX enzymes and inhibit their function, and therefore there's a lack of, or there's less of these prostaglandins released. The inhibition of cyclooxygenase 1 also inhibits platelet aggregation, which is why low doses of aspirin are used chronically to prevent blood clots in patients with risk of blood clots. The long-term use of aspirin has also been found. There are some benefits associated with it, or some clinical or epidemiological studies that have shown lower risk of colon cancer, for example, with the chronic use of low doses of aspirin. Selective cyclooxygenase 2 inhibitors also exist, and most of these NSAIDs that like ibuprofen, etc., are not selective for COX-1 or COX-2 specifically. Maybe more one than the other, but they bind to both. Now, selective COX-2 inhibitors only inhibit COX-2, and they have less of the COX-1 related side effects that we'll go into more in the next slide, specifically the gastrointestinal side of things. But what needs to be considered, as I've just mentioned, that COX-1 inhibits platelet aggregation, COX-2 does not. Therefore, there's none of the cardioprotective benefits associated with COX-2 inhibitors, and therefore celecoxib and etirocoxib are only given on prescription. They are used for long-term treatment of chronic inflammatory conditions, and need to be monitored. The treatment with these drugs need to be monitored by a physician, as really any drug long-term treatment does. Common adverse effects include one that I want to focus on in this presentation is the gastrointestinal issues. Gastrointestinal issues are common side effects of these non-steroidal anti-inflammatory drugs, and this includes stomach irritation, stomach ulcers, gastrointestinal bleeding in some severe circumstances. And typical NSAIDs need to be taken with meals in order to minimize the effects on the short-term treatment side. Long-term, you will have some gas. It's managed. It needs to be managed, the side effects. You cannot always completely avoid it. But that's why listen to your pharmacist when he tells you, he or she tells you that you need to take these things with meals and not on an empty stomach, especially in the short-term side. You will regret taking a pain treatment for something else and then finding that you have another problem rising it because you didn't listen and didn't take your NSAIDs with a meal. It's also important to not exceed the recommended dosages or the instructions given. These limits are placed there for a reason. Remember, these adverse effects are more than just the gastrointestinal tract as well. It's important to take it with a good glass of water, for example. It's also important to drink enough water when you're on NSAIDs because they do need to be eliminated by the kidneys, and they can have some severe effects on your kidneys if you exceed the recommended dosages. Do not drink enough water while you are taking these NSAIDs. It's also important to seek medical advice from a doctor for chronic pain instead of constantly taking over-the-counter preparations. As I previously mentioned, cyclooxygenase 2 NSAIDs require prescription and monitoring by a physician. So it's important that you don't simply self-medicate yourself into oblivion because you're suffering from something, and therefore maybe doing yourself more harm than good by not seeking medical advice. My references are, that's one I quickly want to show you, is my basic clinical pharmacology textbook. And also another reference is experience from working in the pharmacy, not a literary reference per se, but commonly patients who suffer from inflammatory conditions or chronic pain do end up seeking treatment for side effects because of the side effects they suffer from, especially the gastrointestinal tract-related side effects. I typically see people looking for proton pump inhibitors because they suffer from stomach ulcers, because they chronically take over-the-counter anti-inflammatory drugs for, say, something like an arthritis or gout, etc. But instead of seeking medical advice or seeking best advice, they end up just treating side effects. And I'm not saying it's wrong to treat your side effects or to manage these things, but it's important that you seek advice on this. It's important that you consider all the options available and not suffer unnecessarily. Thank you.